You don't have symptoms during menopause because you're losing estrogen. It's because your adrenal glands are exhausted. Your adrenal glands are fatigued.
Okay, hi, I'm Dr. Amy Till. I'm a medical doctor. I have been treating menopausal women for the last 12 years. So this gentleman who has a PhD in philosophy brings up a great point. Now, he's not entirely correct, but he's also not entirely incorrect. Let's break it down. So when you go through the menopause transition, it is true that there is some kind of communication between your ovaries and your adrenal glands that, at least in some women, probably most women, tells the adrenal glands to increase the production of two significant hormones. So the two hormones that are affected are DHEA and something called androstenediol or A-diol. So in studies, about 85% of women seem to have an increased production in those two hormones during the menopause transition when your ovaries are shutting down and no longer producing estrogen and progesterone. In some women, the increase in A-diol is as much as 7 to 8-fold above baseline, which is pretty high. And in those women, it is possible that because the A-diol has some weak estrogen activity, that potentially that's helping with symptoms of the menopause transition. Now, the DHEA, although it can become an estrogen or a testosterone, tends to have more androgenic activity, so it tends to act more like a testosterone during menopause and beyond. Your adrenal glands do continue to make testosterone because that doesn't change with the menopause transition. Later on in the video, he talks about how your adrenal glands, if you treat them right, will continue to make estrogen, progesterone, and testosterone. This is not exactly true, as I demonstrated, but it is true that your adrenal glands can kind of pick up the slack to a degree by increasing these other hormones. What we don't know is what kind of impact these hormones, A-diol and DHEA, have on your menopausal symptoms. We don't know why some women tend to have increased production and others don't. There does seem to be some genetic influences in this, and we don't know if these hormones have any impact on reducing future disease risk. Everyone can benefit by reducing stress and improving sleep and taking care of your adrenals, but I don't buy into the idea of adrenal fatigue, and I don't buy into the idea that just because you lead a healthy lifestyle, you won't suffer at menopause. I hope that's helpful.